Hello students, drawings help you to understand a topic better and also help you with a better recall. So are you ready students? Let's begin a diagram. Always begin by drawing the thyroid cartilages. Okay, so let's first draw the cartilage here. Okay, then you draw your cricoid cartilage below that. Draw T1, draw T2, draw T3, draw T4, T5 and T6. Here you have your cartilages in place. You can even color them if you feel comfortable doing that. Now draw an oblique line on your thyroid cartilage, please. This is the upper limit of where your thyroid gland will be extending. Now begin to draw your thyroid gland. How do we do that? First mark your T2 and T4. Tracheal ring 2, tracheal ring 4. Start your gland from there, extend it upwards till the oblique line on thyroid cartilage. Extend it down and bring it right up till the level of T4. Don't extend it too far. Some of you might want to also draw a little apex in the midline, which indicates presence of a pyramidal lobe of thyroid gland. If you are smart now, you would use this time to quickly color off your gland. Remember to color it using a very light shade because there's a lot more happening in this diagram later. Okay. Let's now talk about some of the arterial supply venous drainage to complete the diagram. Okay. Use the right color, students. Enjoy the process of drawing. For God's sake, don't look at it like a job. Okay. It's not a job. It's something that's giving you some enjoyment in the process of learning. So let's begin by drawing our superior thyroid artery, which is extending downwards from above, reaching the apex of the gland, descending downwards and anastomosing above the isthmus with the fellow of the opposite side. It's also giving rise to a posterior branch, which remember you have to draw dotted, indicating that it is posterior. Similarly, draw your inferior thyroid artery, which forms a loop below, okay, supplying the glandular tissue through the descending branch and then passing upwards to anastomose with the branch that came from the superior thyroid artery. Remember, all these structures that are behind the thyroid gland must be drawn as dotted lines. Okay. So, any artery I have forgotten, students? Yes, I have forgotten to draw my thyroidea ema artery, which comes from below and supplies the lower border. So that completes our arterial supply. Let's now go to the venous drainage. Okay, take a nice blue color. Drain your veins laterally into the internal jugular vein. That's the first superior thyroid vein. That's the middle thyroid vein. That's your internal jugular into which they're all draining. From the lower border, draw your inferior thyroid veins to draining into the left brachiocephalic vein. The left brachiocephalic you should be able to draw meeting with the right brachiocephalic, together forming the superior vena cava. If you are smart, you would color off all these because you know it helps you to have a perspective when you have the right colors in place. Okay. Now let's draw the last thing that's required, that's your nerves. Okay. So let's begin. Accompanying the superior thyroid artery was your external laryngeal nerve. Close to the apex, the external laryngeal nerve passed deep. What should you do now, students? By now you know what I say. If it's lying posteriorly, you are going to draw it dotted. Perfect. From below, coming towards the thyroid gland is the recurrent laryngeal nerve, which again becomes dotted because it's going behind and passes very close to the inferior thyroid artery. This, my dear students, completes the diagram of thyroid gland. If you want, you can also add the last bit to this, which is the levator glanduli thyroidea, which is a single structure that is extending upwards, connecting your thyroid gland to the hyoid bone. Okay, it's a fibromuscular structure, I'm sure you know that. Okay, so this completes our diagram. Let's come back to the screen. Remember to revise this diagram again and again. It will give you information about arterial supply, venous drainage, nerve supply, as well as exact positioning of the thyroid gland and isthmus. Okay.